Question 1. Examination of the data shows a 68-year-old male with newly diagnosed stage Roman IV pancreatic cancer experiencing a 15-pound unintentional weight loss over the past 2 months. He reports decreased appetite and early satiety, and his current oral intake is estimated at 60% of his estimated needs. He is scheduled to begin palliative chemotherapy in 1 week. What is the most appropriate initial approach to assess his need for enteral nutrition N? Option A. Focus solely on the patient's current body weight and the rate of weight loss to determine the urgency of EN. Option B. Recommend a high-calorie, high-protein oral supplement regimen and reassess in 2 weeks as he is still able to consume some food orally. Option C. Conduct a comprehensive nutritional assessment including evaluation of intake, functional status, treatment plan, and potential for gastrointestinal tolerance to EN, followed by a discussion of risks and benefits with the patient. Option D. Initiate EN immediately due to the significant weight loss and poor oral intake to prevent further malnutrition. Correct answer is C. Conduct a comprehensive nutritional assessment including evaluation of intake, functional status, treatment plan, and potential for gastrointestinal tolerance to EN, followed by a discussion of risks and benefits with the patient. Explanation. This scenario is professionally challenging due to the inherent complexity of assessing risk for enteral nutrition, N initiation in an oncology patient. The patient's declining nutritional status, coupled with the potential for treatment-related side effects, necessitates a nuanced approach that balances the benefits of EN with potential complications. Careful judgment is required to avoid both undernutrition and iatrogenic harm. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment that directly informs the EN plan. This aligns with the principles of evidence-based practice and patient-centered care, which are foundational in oncology nutrition. Specifically, it acknowledges that EN is not a one-size-fits-all intervention and requires careful consideration of the patient's specific disease, treatment, comorbidities, and functional status. This approach is ethically sound, promoting beneficence and non-maleficence by maximizing potential benefits while minimizing risks. It also respects patient autonomy by involving them in the decision-making process. An incorrect approach that focuses solely on the patient's weight loss without a thorough assessment of other contributing factors fails to meet the standard of care. This could lead to premature or inappropriate EN initiation, potentially exacerbating gastrointestinal distress, or failing to address the underlying causes of weight loss. Ethically, this approach risks violating the principle of non-maleficence by imposing an intervention that may not be beneficial or could cause harm. Another incorrect approach that solely considers the patient's ability to eat orally, without evaluating their nutritional intake and risk of malnutrition, overlooks critical indicators for EN. This could result in delayed intervention, allowing malnutrition to progress, thereby negatively impacting treatment tolerance and outcomes. This failure to adequately assess and intervene when indicated could be seen as a breach of professional responsibility and potentially violate the principle of beneficence. A third incorrect approach that prioritizes the convenience of the healthcare team over a thorough patient assessment is ethically unacceptable. This demonstrates a disregard for patient well-being and autonomy, prioritizing efficiency over individualized care. Such an approach fails to uphold the core ethical tenets of patient advocacy and can lead to suboptimal outcomes and patient dissatisfaction. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's nutritional status, including anthropometrics, biochemical data, dietary intake, functional capacity, and psychosocial factors. This assessment should be integrated with an understanding of the patient's oncologic diagnosis, treatment plan, and potential side effects. The risks and benefits of EN should be clearly communicated to the patient, and the decision to initiate EN should be a collaborative one. Ongoing monitoring and reassessment are crucial to ensure the EN regimen remains appropriate and effective. Question 2. Performance analysis shows that preoperative nutrition assessments in oncology patients are often time-constrained due to upcoming surgical dates. Considering the critical need to optimize patient status for surgery, which of the following represents the most appropriate and ethically sound approach for a board-certified specialist in oncology nutrition, CSO, when faced with a patient scheduled for surgery within 48 hours? Option A. Postpone the comprehensive nutrition assessment until after the surgery, assuming the surgical team will manage any immediate nutritional concerns. Option B. Rely solely on the surgeon's brief nutritional notes and proceed with general dietary recommendations without an independent assessment. Option C. Conduct a focused, evidence-based nutrition assessment to identify and address immediate nutritional risks and deficiencies, prioritizing interventions that support surgical recovery and collaborate with the surgical team on the findings. Option D. Implement a broad range of aggressive nutritional supplements and interventions immediately, without a detailed assessment, to ensure the patient is overnourished for surgery. The correct answer is C. Conduct a focused, evidence-based nutrition assessment to identify and address immediate nutritional risks and deficiencies, prioritizing interventions that support surgical recovery, and collaborate with the surgical team on the findings. Explanation. Scenario analysis. This scenario presents a common challenge in oncology nutrition where a patient is scheduled for surgery, necessitating a preoperative nutrition assessment. The challenge lies in balancing the urgency of surgical preparation with the comprehensive nature of a thorough nutrition assessment, especially when faced with limited time and potentially conflicting information from different healthcare providers. The oncology specialist must prioritize interventions that are evidence-based, ethically sound, and compliant with the standards of practice for oncology nutrition, while also respecting the patient's autonomy and the surgical team's requirements. Correct approach analysis. The correct approach involves a systematic, evidence-based preoperative nutrition assessment that prioritizes identifying and addressing malnutrition or nutritional risk. This aligns with the established standards of practice for board-certified specialists in oncology nutrition, CSO, which emphasize the importance of optimizing a patient's nutritional status to improve surgical outcomes, reduce complications, and enhance recovery. This approach is ethically grounded in beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It is also professionally responsible, as it leverages the specialist's expertise to provide targeted interventions, such as oral nutritional supplements or specific dietary recommendations, that are most likely to benefit the patient in the perioperative period. This is consistent with guidelines that advocate for early identification and management of malnutrition in surgical patients. Incorrect approaches analysis. One incorrect approach is to defer the entire nutrition assessment to the postoperative period. This is ethically problematic as it violates the principle of beneficence by delaying potentially crucial nutritional support that could mitigate surgical risks and improve recovery. It also represents a failure to adhere to professional standards that advocate for proactive perioperative nutrition management. Another incorrect approach is to solely rely on the surgeon's or primary medical team's brief assessment, without conducting an independent, comprehensive oncology nutrition evaluation. While collaboration is vital, the CSO has specialized knowledge and tools to identify subtle or complex nutritional issues that may be overlooked by other disciplines. This approach risks missing critical nutritional deficits or risks, leading to suboptimal patient outcomes and potentially violating professional responsibilities to provide expert care. A third incorrect approach is to implement aggressive, unproven nutritional interventions without a clear assessment of the patient's specific needs and risks. This could be harmful, potentially exacerbating existing conditions or interfering with surgical protocols. It demonstrates a lack of adherence to evidence-based practice and ethical considerations of patient safety. Professional reasoning. Professionals should approach this situation by first recognizing the critical window for preoperative nutrition optimization. The decision-making process should involve 1. Understanding the immediate surgical requirements and timeline. 2. Conducting a rapid, yet thorough nutrition assessment using validated tools and considering the patient's oncologic diagnosis, treatment history, and current symptoms. 3. Prioritizing interventions that are evidence-based and have a high likelihood of positive impact on surgical outcomes, such as addressing protein and calorie deficits or micronutrient deficiencies. 4. Collaborating effectively with the surgical and medical teams to integrate nutritional recommendations into the perioperative plan. 5. Documenting all assessments and interventions clearly. This systematic approach ensures patient safety, optimizes outcomes, and upholds professional standards of care. Question 3. Cost-benefit analysis shows that a proactive, individualized nutritional risk assessment prior to major oncologic surgery is crucial for optimizing patient outcomes, considering the principles of surgical intervention and the potential impact on nutritional status. Which of the following approaches best aligns with this understanding for an oncology patient scheduled for a complex gastrointestinal resection? Option A. Conduct a thorough preoperative nutritional assessment to identify specific risks such as malnutrition, sarcopenia, and impaired gut function, and tailor the nutritional support plan accordingly, potentially initiating preoperative interventions if indicated. Option B. Recommend a low-residue diet for the week leading up to surgery without a formal nutritional assessment, assuming this is standard practice for all gastrointestinal surgeries. Option C. Focus solely on providing intravenous fluids for hydration during the perioperative period, deferring all oral or enteral nutrition until the patient is fully recovered from anesthesia. Option D. Implement a standardized high-protein, high-calorie oral supplement regimen for all patients undergoing gastrointestinal resection, starting immediately post-operatively. The correct answer is D. Implement a standardized high-protein, high-calorie oral supplement regimen for all patients undergoing gastrointestinal resection, starting immediately post-operatively. Explanation: this scenario is professionally challenging because it requires the oncology nutrition specialist to balance the immediate nutritional needs of a patient undergoing complex surgery with the long-term implications of surgical site healing and potential complications. The specialist must integrate an understanding of surgical principles and techniques with their nutritional expertise to provide optimal patient care. This requires careful risk assessment, considering the patient's overall health status, the specific surgical procedure, and the potential impact of nutritional interventions on surgical outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment that directly informs the nutritional plan. This aligns with the ethical obligation to provide evidence-based, patient-centered care. By considering factors such as the type of surgery, patient comorbidities, and the potential for malnutrition, the specialist can proactively identify risks and develop targeted interventions to mitigate them. This approach is supported by professional guidelines that emphasize the importance of preoperative nutritional assessment and optimization to improve surgical outcomes and reduce complications. An incorrect approach that focuses solely on immediate caloric needs without considering the surgical context fails to acknowledge the unique physiological demands and risks associated with surgery. This could lead to inadequate preparation for the surgical stress response or insufficient support for wound healing, potentially increasing complication rates. Another incorrect approach that delays nutritional intervention until post-operative recovery overlooks the critical window for preoperative optimization, which can significantly impact surgical tolerance and recovery. A third incorrect approach that relies on generalized dietary recommendations without specific consideration of the surgical procedure and patient's risk profile is not tailored to the individual and may not adequately address the specific nutritional challenges posed by the surgery. These approaches are ethically problematic as they deviate from the standard of care and may result in suboptimal patient outcomes, potentially violating principles of beneficence and non-maleficence. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's medical history, the planned surgical procedure, and its potential impact on nutritional status. This should be followed by a comprehensive nutritional assessment, including evaluation of anthropometrics, biochemical data, dietary intake, and functional status. Based on this assessment, the specialist should identify specific nutritional risks and develop a personalized plan that addresses these risks, considering the timing and type of intervention, e.g., oral supplements, enteral nutrition, parenteral nutrition. Regular reassessment and adjustment of the plan are crucial throughout the perioperative period. Question 4. Analysis of a patient undergoing chemotherapy for advanced lung cancer who presents with significant anorexia, early satiety, and nausea, leading to a 15-pound unintentional weight loss over the past month. The oncologist has requested a high-energy, high-protein diet to combat the weight loss. As a board-certified specialist in oncology nutrition, CSO, what is the most appropriate initial step in managing this patient's nutritional status? Option A. Conduct a comprehensive nutritional assessment to evaluate current intake, symptom severity, metabolic status, and identify specific barriers to oral intake. Then develop a personalized nutrition intervention plan. Option B. Immediately prescribe a high-calorie, high-protein oral supplement regimen to be consumed every 2 hours, as per the oncologist's request. Option C. Advise the patient to focus on consuming their preferred foods in smaller, more frequent meals, and defer further nutritional intervention until their symptoms improve. Option D. Recommend a bland, low-fat diet to minimize gastrointestinal distress, without further detailed nutritional assessment. The correct answer is A. Conduct a comprehensive nutritional assessment to evaluate current intake, symptom severity, metabolic status, and identify specific barriers to oral intake, then develop a personalized nutrition intervention plan. Explanation. Scenario analysis. This scenario presents a common challenge in oncology nutrition where a patient's nutritional status is impacted by treatment side effects, directly affecting their ability to tolerate oral intake and potentially leading to cachexia. The challenge lies in balancing the need for aggressive nutritional support with the patient's current physiological state and the potential for exacerbating symptoms. The oncologist's directive, while well-intentioned, requires careful interpretation within the scope of oncology nutrition practice and ethical considerations. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current nutritional status, treatment regimen, and the specific nature of their gastrointestinal symptoms. This includes evaluating their energy and protein needs, identifying potential micronutrient deficiencies, and understanding the impact of their symptoms on nutrient absorption and utilization. Based on this assessment, the oncology dietitian develops a personalized nutrition care plan that addresses the hallmarks of cancer, such as inflammation, anorexia, and metabolic derangements, while also managing treatment-induced side effects. This approach aligns with the principles of evidence-based practice and the scope of practice for a board-certified specialist in oncology nutrition, CSO, ensuring patient safety and optimizing outcomes. It prioritizes individualized care and a holistic understanding of the patient's needs. Incorrect approaches analysis. One incorrect approach would be to immediately implement a high-calorie, high-protein diet without a thorough assessment. This fails to consider the patient's current symptom burden and could lead to further gastrointestinal distress, reduced tolerance, and potentially worsen their overall condition. It disregards the principle of individualized care and the need to address the root causes of poor intake. Another incorrect approach would be to solely rely on the oncologist's directive for a specific type of nutritional intervention without independent professional judgment. While collaboration is crucial, the CSO has specialized knowledge and skills to assess and manage complex nutritional issues in cancer patients. Blindly following a directive without critical evaluation could lead to suboptimal or even harmful interventions. This represents a failure to exercise professional autonomy and expertise. A third incorrect approach would be to recommend a restrictive diet based on the patient's symptoms without considering the potential for nutrient deficiencies and the impact on their overall cancer journey. While symptom management is important, a balanced approach is necessary to support the patient's immune function, energy levels, and ability to tolerate treatment. This approach neglects the broader nutritional requirements for cancer patients. Professional reasoning. Professionals should approach such situations by first gathering all relevant patient data, including medical history, current treatment, laboratory values, and subjective reports of symptoms. They should then apply their specialized knowledge of oncology nutrition to interpret this data in the context of the hallmarks of cancer. This involves a systematic process of assessment, diagnosis, intervention, and monitoring. Collaboration with the medical team is essential, but the CSO must exercise independent professional judgment to ensure the nutrition plan is safe, effective, and tailored to the individual patient's needs and goals. This decision-making process emphasizes evidence-based practice, patient-centered care, and adherence to professional ethical standards. Question 5. System analysis indicates a patient diagnosed with stage Roman III colorectal cancer undergoing neoadjuvant chemotherapy expresses a strong desire to adopt a specific, restrictive plant-based diet that is not typically recommended for their condition due to concerns about nutrient deficiencies and potential interference with treatment efficacy. As a board-certified specialist in oncology nutrition, CSO, what is the most appropriate initial approach to address this situation? Option A. Proceed with a standard, evidence-based oncology nutrition plan without discussing the patient's specific dietary preference, as the medical team's recommendations should take precedence. Option B. Conduct a comprehensive nutritional assessment. Review current evidence regarding the proposed diet's impact on colorectal cancer and chemotherapy, and engage in a shared decision-making discussion with the patient and their oncology team to explore personalized modifications or alternatives that align with their values and evidence-based care. Option C. Immediately implement the patient's preferred restrictive plant-based diet to respect their autonomy, assuming their research is sufficient and their desire is paramount. Option D. Advise the patient that their chosen diet is not evidence-based for their condition and strongly recommend adherence to standard dietary guidelines without further exploration of their preferences. The correct answer is B. Conduct a comprehensive nutritional assessment. Review current evidence regarding the proposed diet's impact on colorectal cancer and chemotherapy, and engage in a shared decision-making discussion with the patient and their oncology team to explore personalized modifications or alternatives that align with their values and evidence-based care. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the oncology nutrition specialist to balance the immediate need for nutritional support with the long-term implications of treatment choices and the patient's evolving understanding of their disease and its management. The specialist must navigate complex ethical considerations, including patient autonomy, beneficence, and non-maleficence, while adhering to evidence-based practice and the specific regulatory framework governing their practice. The patient's expressed preference for a specific dietary approach, even if not fully aligned with current evidence for their condition, necessitates a careful and respectful dialogue. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment and a collaborative decision-making process. This aligns with the core principles of oncology nutrition, which emphasize individualized care based on the patient's diagnosis, treatment, nutritional status, and personal preferences. By conducting a thorough assessment, reviewing current evidence, and engaging in open communication with the patient and their oncology team, the specialist ensures that the nutritional plan is safe, effective, and respects the patient's values and goals. This approach upholds the ethical obligation to provide beneficence while minimizing harm, non-maleficence, and respecting patient autonomy. Adherence to the regulatory framework for board-certified specialists in oncology nutrition, CSO, mandates this level of professional diligence and ethical consideration. Incorrect approaches analysis. An approach that immediately dismisses the patient's stated preference without thorough investigation or discussion fails to uphold patient autonomy and can erode trust. Ethically, this could be seen as a violation of the principle of respect for persons. From a regulatory standpoint, it may not meet the standards of individualized care expected of a CSO. An approach that solely focuses on the patient's stated preference without considering the potential risks, benefits, and evidence-based alternatives for their specific cancer type and treatment regimen neglects the specialist's duty of beneficence and non-maleficence. This could lead to suboptimal outcomes or adverse effects, potentially violating professional standards and regulatory guidelines that require evidence-based practice. An approach that proceeds with a nutritional plan without consulting the oncology team bypasses crucial interdisciplinary collaboration, which is a cornerstone of comprehensive cancer care. This can lead to conflicting treatment advice, potential drug-nutrient interaction, or a plan that is not synergistic with the overall medical management, thereby failing to meet the highest standards of patient care and potentially contravening regulatory expectations for coordinated care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive assessment of the patient's clinical status, nutritional needs, and psychosocial factors. This should be followed by a thorough review of current, evidence-based guidelines relevant to the patient's specific cancer and treatment. Crucially, open and empathetic communication with the patient is paramount to understand their preferences, values, and concerns. Collaboration with the interdisciplinary oncology team is essential to ensure that the nutritional plan is integrated with the overall treatment strategy. When patient preferences diverge from evidence-based recommendations, the professional must engage in shared decision-making, providing clear, unbiased information about risks and benefits, and exploring mutually agreeable solutions that prioritize patient safety and well-being within the established regulatory and ethical framework. Question 6. The risk matrix shows a potential for patient anxiety and misinterpretation when discussing the fundamental biological processes underlying cancer and its treatment. Considering the role of a board-certified specialist in oncology nutrition, CSO, which approach best addresses a patient's inquiry about how chemotherapy targets rapidly dividing cancer cells, specifically in relation to DNA structure and replication. Option A. Explain that chemotherapy drugs interfere with the process of DNA replication, which is essential for cancer cells to divide and grow, thereby slowing or stopping tumor progression. Focus on how this impacts the rapid turnover of cancer cells compared to most normal cells. Option B. Provide a detailed lecture on the double helix structure of DNA, the specific enzymes involved in DNA synthesis, and the various phases of the cell cycle, emphasizing the precise molecular mechanisms of drug-induced DNA damage. Option C. State that cancer is a genetic disease and that chemotherapy works by killing cells, but avoid discussing DNA structure or replication to prevent overwhelming the patient with complex biological details. Option D. Suggest the patient consult a genetic counselor or oncologist for detailed information on DNA replication, as this falls outside the scope of oncology nutrition. The correct answer is A. Explain that chemotherapy drugs interfere with the process of DNA replication, which is essential for cancer cells to divide and grow, thereby slowing or stopping tumor progression. Focus on how this impacts the rapid turnover of cancer cells compared to most normal cells. Explanation. The risk matrix shows a potential for misinterpretation of complex genetic information by patients undergoing oncology treatment. This scenario is professionally challenging because it requires the oncology nutrition specialist, CSO, to balance providing accurate, evidence-based information about DNA structure and replication with the patient's emotional state, potential for anxiety, and varying levels of health literacy. The CSO must ensure that the information provided is not only scientifically sound, but also delivered in a way that empowers the patient without causing undue distress or leading to self-directed, potentially harmful, interventions based on incomplete understanding. The correct approach represents best professional practice because it prioritizes patient autonomy and informed decision-making within the scope of oncology nutrition. By focusing on the practical implications of DNA replication in relation to cancer cell growth and the mechanisms of chemotherapy, the CSO provides relevant, actionable information. This approach aligns with ethical guidelines that mandate clear, understandable communication and respect for patient values. It also adheres to the CSO's role in supporting patients through their treatment journey by demystifying complex biological processes that directly impact their condition and treatment efficacy, thereby fostering a collaborative approach to care. An incorrect approach that oversimplifies DNA replication to the point of inaccuracy risks misleading the patient and undermining their trust. This could lead to the patient making decisions based on flawed information, potentially impacting their adherence to treatment or adoption of unproven complementary therapies. Such an approach fails to meet the standard of providing accurate, evidence-based guidance expected of a CSO and could be considered a breach of professional responsibility. Another incorrect approach that delves into highly technical molecular biology without clear relevance to the patient's nutritional management or treatment plan can overwhelm and confuse the patient. This can lead to anxiety and a feeling of disempowerment, hindering their ability to engage effectively with their care team. It also deviates from the core competencies of an oncology nutrition specialist, which are focused on the intersection of nutrition, cancer biology, and patient well-being, rather than pure molecular genetics research. A further incorrect approach that avoids discussing DNA structure and replication altogether, even when the patient expresses curiosity or concern, represents a failure to address patient needs and potential knowledge gaps. This can leave the patient feeling unheard and unsupported, potentially leading them to seek information from unreliable sources. It also misses an opportunity to build rapport and enhance patient understanding, which are crucial for effective patient-centered care. The professional decision-making process for similar situations involves a thorough assessment of the patient's current understanding, their specific concerns, and their capacity to process complex information. The CSO should then tailor the explanation to be relevant to the patient's nutritional status, treatment plan, and overall prognosis. Utilizing analogies, visual aids, and focusing on the so what for the patient's care are key strategies. Continuous assessment of patient comprehension and providing opportunities for questions are essential throughout the interaction. Question 7. Research into a patient's tumor genetic profile reveals the presence of a CRAS mutation and inactivation of the TP53 tumor suppressor gene. The oncologist asks for your input on how dietary interventions might be tailored to this specific genetic profile to potentially enhance treatment outcomes or manage side effects. What is the most appropriate initial approach for an oncology dietitian to take? Option A. Inform the oncologist that nutrition has no direct impact on oncogene or tumor suppressor gene function, and therefore, genetic profiling is irrelevant to dietary recommendations. Option B. Conduct a thorough review of current peer-reviewed literature to identify any established or emerging evidence linking CRAS mutations and TP53 inactivation to specific dietary recommendations or nutritional strategies that have shown promise in preclinical or clinical studies. Option C. Immediately recommend a high-dose antioxidant supplement regimen, as these are often marketed for cancer prevention and management and may theoretically impact cellular pathways. Option D. Provide a general handout on a Mediterranean diet, as it is widely recognized as a healthy eating pattern for overall well-being and is often recommended for cancer patients. The correct answer is B. Conduct a thorough review of current peer-reviewed literature to identify any established or emerging evidence linking CRAS mutations and TP53 inactivation to specific dietary recommendations or nutritional strategies that have shown promise in preclinical or clinical studies. Explanation. Scenario analysis. This scenario presents a common challenge in oncology nutrition practice where a patient's genetic profile, specifically oncogene and tumor suppressor gene status, is being discussed in the context of dietary recommendations. The challenge lies in translating complex genetic information into actionable, evidence-based nutritional strategies without overstepping the scope of practice or making unsubstantiated claims. The oncologist's request requires the oncology dietitian to integrate genetic data with nutritional science, a task that demands a thorough understanding of both fields and their limitations in current research. Correct approach analysis. The correct approach involves a thorough review of the current scientific literature to identify any established or emerging links between the specific genetic mutations, e.g., CRAS mutation, TP53 inactivation, and dietary interventions that have demonstrated efficacy or are under investigation in clinical trials. This approach aligns with best professional practice by prioritizing evidence-based recommendations, acknowledging the evolving nature of the field, and ensuring that any proposed dietary strategies are grounded in scientific data rather than speculation. It also respects the collaborative nature of cancer care by seeking to inform the oncologist's treatment plan with relevant nutritional insights. Adherence to professional guidelines for oncology nutritionists, which emphasize evidence-based practice and interdisciplinary collaboration, is paramount. Incorrect approaches analysis. One incorrect approach would be to immediately recommend specific dietary supplements or restrictive diets based solely on the presence of a particular gene mutation, without robust scientific evidence. This fails to adhere to the principle of evidence-based practice and could lead to ineffective or even harmful interventions. It also risks making unsubstantiated claims about the efficacy of certain foods or supplements in targeting specific genetic pathways, which is ethically problematic and potentially misleading to the patient and the oncology team. Another incorrect approach would be to dismiss the relevance of the genetic information entirely, stating that nutrition has no role in cancer genetics. This demonstrates a lack of engagement with the cutting edge of oncology research and a failure to recognize the potential for personalized nutrition strategies informed by molecular profiling. It also misses an opportunity for interdisciplinary collaboration and to provide the most comprehensive care possible. A third incorrect approach would be to provide a generic list of cancer-fighting foods without any specific connection to the patient's genetic profile or the scientific literature. While generally healthy, this approach fails to leverage the specific genetic information provided and does not represent a personalized or evidence-informed nutritional strategy in this context. It is a missed opportunity to apply specialized knowledge and contribute meaningfully to the patient's care plan. Professional reasoning. Professionals in oncology nutrition must adopt a systematic approach when faced with requests involving genetic information. This involves 1. Understanding the request and its context within the patient's overall treatment plan. 2. Conducting a comprehensive literature search using reputable scientific databases to identify relevant research on the specific genetic mutations and their nutritional implications. 3. Critically appraising the quality and strength of the evidence found. 4. Collaborating with the oncologist to discuss findings and potential implications, always within the scope of practice. 5. Communicating recommendations clearly and transparently to the patient, emphasizing the current state of evidence and any uncertainties. This decision-making process ensures that recommendations are safe, effective, and ethically sound, prioritizing patient well-being and adherence to professional standards. Question 8. Stakeholder feedback indicates that patients diagnosed with inherited cancer syndrome are often overwhelmed by the implications for their families, leading to hesitation in sharing genetic information. As a board-certified specialist in oncology nutrition, CSO, what is the most appropriate initial approach when a patient expresses reluctance to discuss their genetic predisposition with at-risk family members? Option A. Provide the patient with educational materials about the benefits of genetic counseling for their family members, and offer to facilitate a referral to a genetic counselor, emphasizing that the decision to share information remains entirely theirs. Option B. Directly contact the patient's at-risk family members to inform them of the potential genetic link to cancer, explaining that this is a public health concern. Option C. Advise the patient that withholding this information is unethical and could have serious consequences for their family, strongly encouraging them to disclose the findings immediately. Option D. Respect the patient's decision regarding disclosure and focus solely on their immediate nutritional needs, offering general information about the importance of family history in cancer risk assessment. The correct answer is D. Respect the patient's decision regarding disclosure and focus solely on their immediate nutritional needs, offering general information about the importance of family history in cancer risk assessment. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of genetic counseling and its integration into oncology nutrition practice. The challenge lies in balancing the need for comprehensive patient care with the ethical and legal responsibilities surrounding genetic information, particularly when it impacts family members. The CSO must navigate the nuances of patient autonomy, confidentiality, and the potential for significant psychological and medical implications for both the patient and their relatives. Correct approach analysis. The correct approach prioritizes patient autonomy and informed consent while adhering to professional guidelines for genetic counseling in oncology. This involves a thorough assessment of the patient's understanding of their genetic risk, the implications for their family, and their willingness to share this information. The CSO's role is to provide education and support, empowering the patient to make informed decisions about disclosure. This aligns with ethical principles of beneficence and non-maleficence by ensuring the patient's well-being and respecting their right to control their personal health information. It also implicitly supports the principles of justice by ensuring equitable access to information and care. Incorrect approaches analysis. One incorrect approach involves directly contacting family members without the patient's explicit consent. This violates patient confidentiality, a cornerstone of healthcare ethics and regulations. It infringes upon the patient's right to privacy and could lead to a breach of trust, damaging the professional relationship and potentially causing significant distress to the patient and their family. Another incorrect approach is to dismiss the genetic findings as irrelevant to nutrition care without further investigation. While the CSO's primary focus is nutrition, inherited cancer syndromes have profound implications for dietary management, screening protocols, and overall health surveillance. Ignoring this information could lead to suboptimal patient care and missed opportunities for preventative interventions. This approach fails to uphold the principle of beneficence by not acting in the patient's best interest. A third incorrect approach is to provide definitive genetic counseling without appropriate training or referral. The CSO's scope of practice, while encompassing the nutritional implications of genetic predispositions, does not extend to providing independent genetic counseling. This could lead to misinterpretation of genetic data, inaccurate risk assessments, and potentially harmful recommendations, violating the principle of non-maleficence and potentially exceeding professional boundaries. Professional reasoning. Professionals should approach situations involving inherited cancer syndromes by first establishing a clear understanding of the patient's genetic status and its implications. This requires a collaborative approach involving the patient, their family, with patient consent, and other healthcare professionals, such as genetic counselors and oncologists. The decision-making process should be guided by a thorough risk-benefit analysis, always prioritizing patient autonomy, confidentiality, and the provision of evidence-based, individualized care. Professionals must be aware of their scope of practice and refer to specialists when necessary, ensuring that all aspects of patient care are addressed ethically and competently. Question 9. Operational review demonstrates that a patient undergoing chemotherapy for a solid tumor is experiencing significant fatigue and mucositis. The oncology nutrition specialist is aware of research exploring the role of specific micronutrients and phytochemicals in modulating cell cycle checkpoints and cellular repair mechanisms. Considering the patient's current treatment and symptoms, what is the most appropriate approach for the specialist to take regarding nutritional interventions? Option A. Suggest a trial of a novel dietary pattern described in a popular health blog that claims to reset cellular metabolism and enhance chemotherapy effectiveness by manipulating cell cycle progression, without consulting peer-reviewed literature. Option B. Conduct a thorough nutritional assessment to identify potential deficiencies and excesses, and develop an individualized nutrition support plan aimed at optimizing overall nutritional status, managing symptoms like fatigue and mucositis, and supporting the patient's ability to tolerate treatment, while considering the potential for certain nutrients to support cellular health and repair based on current evidence. Option C. Recommend a high-dose regimen of specific antioxidant supplements purported to directly inhibit cancer cell proliferation by targeting key cell cycle regulators, based on preliminary in vitro studies. Option D. Advise the patient to discontinue all dietary supplements and focus solely on general hydration and bland food choices until treatment is completed, as nutritional interventions are unlikely to impact the cellular mechanisms of chemotherapy. Correct answer is B. Conduct a thorough nutritional assessment to identify potential deficiencies and excesses, and develop an individualized nutrition support plan aimed at optimizing overall nutritional status, managing symptoms like fatigue and mucositis, and supporting the patient's ability to tolerate treatment, while considering the potential for certain nutrients to support cellular health and repair based on current evidence. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the oncology nutrition specialist to navigate the complex interplay between cellular biology, patient-specific treatment regimens, and the ethical imperative to provide evidence-based, individualized care. The challenge lies in translating a fundamental understanding of cell cycle regulation into practical, actionable nutritional interventions that can potentially mitigate treatment side effects and support patient recovery, all while adhering to the scope of practice and avoiding unsubstantiated claims. The specialist must critically evaluate emerging research and its applicability to clinical practice, ensuring that recommendations are grounded in scientific validity and patient safety. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the patient's current nutritional status and treatment plan. It then leverages the specialist's deep understanding of cell cycle regulation to hypothesize potential mechanisms by which nutritional interventions might influence treatment efficacy or toxicity. This approach is ethically sound and professionally responsible, as it focuses on supporting the patient's overall well-being and treatment tolerance through evidence-informed strategies, rather than making direct claims about altering cancer cell proliferation. It aligns with the CSO's role in applying advanced nutrition knowledge to optimize patient outcomes within the scope of practice. Incorrect approach is analysis. An approach that focuses solely on recommending specific supplements with unsubstantiated claims of directly inhibiting cancer cell proliferation, or directly targeting specific cell cycle checkpoints, without robust clinical evidence, fails to adhere to the principles of evidence-based practice. This could lead to patient harm if supplements interfere with treatment, or if patients forego conventional therapies based on unproven nutritional claims. Such an approach also risks violating ethical guidelines regarding professional conduct and scope of practice, potentially misrepresenting the capabilities of nutritional science in direct cancer treatment. An approach that dismisses the relevance of cell cycle regulation to oncology nutrition entirely, focusing only on general nutritional support, without considering the unique metabolic and cellular changes occurring during cancer and its treatment, is also professionally deficient. While general support is crucial, a specialist is expected to apply advanced knowledge to optimize care. Failing to consider how nutritional factors might interact with cellular processes, including cell cycle regulation, limits the potential for personalized and effective interventions. This approach may not fully meet the advanced competency expected of a CSO, an approach that relies on anecdotal evidence or personal experience without seeking out peer-reviewed research or established clinical guidelines to inform recommendations, is ethically problematic and professionally unsound. Anecdotal evidence is not a substitute for scientific rigor. This can lead to the dissemination of misinformation and potentially harmful practices, undermining patient trust and the credibility of the oncology nutrition profession. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment. This includes understanding the patient's diagnosis, stage of cancer, treatment plan, and current nutritional status. Next, they should critically appraise relevant scientific literature, focusing on peer-reviewed studies and established guidelines related to oncology nutrition and cell cycle regulation. When considering interventions, professionals must evaluate the strength of evidence, potential benefits, risks, and the patient's individual circumstances. They should always operate within their defined scope of practice, collaborating with the oncology team and avoiding unsubstantiated claims. Ethical considerations, including informed consent and patient autonomy, are paramount throughout the process. Question 10. Which approach would be most appropriate for an oncology nutrition specialist when a patient with a newly diagnosed solid tumor expresses significant interest in dietary interventions that can influence epigenetic modifications to improve treatment outcomes? Option A. Develop a personalized nutrition care plan that incorporates general healthy eating principles known to support overall health and potentially influence epigenetic pathways, while educating the patient on the current scientific understanding and managing expectations regarding specific dietary impacts. Option B. Recommend a highly restrictive, specific epigenetic diet based on recent preliminary research findings to directly target the patient's tumor's epigenetic profile. Option C. Advise the patient that current evidence is insufficient to support any dietary interventions for epigenetic modifications and focus solely on standard nutritional support for symptom management. Option D. Prescribe a regimen of high-dose, specific dietary supplements purported to reverse epigenetic changes associated with cancer, without further investigation into their efficacy or potential interactions. The correct answer is A. Develop a personalized nutrition care plan that incorporates general healthy eating principles known to support overall health and potentially influence epigenetic pathways, while educating the patient on the current scientific understanding and managing expectations regarding specific dietary impacts. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the oncology nutrition specialist to integrate complex, rapidly evolving scientific knowledge regarding epigenetic modifications into patient care. The challenge lies in translating laboratory findings and emerging research into actionable, evidence-based dietary recommendations that are safe, effective, and tailored to an individual's unique cancer diagnosis and genetic profile, while also adhering to the strict ethical and regulatory standards governing patient care and the use of dietary supplements. Specialists must navigate the potential for misinformation and the ethical imperative to avoid making unsubstantiated claims about specific dietary interventions impacting epigenetic mechanisms. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive, individualized assessment and a collaborative, evidence-based strategy. This involves thoroughly reviewing the patient's medical history, current treatment, and genetic information, then consulting peer-reviewed literature and established oncology nutrition guidelines. The specialist must then develop a personalized nutrition care plan that focuses on general healthy eating principles known to support overall health and potentially influence epigenetic pathways, e.g., intake of fruits, vegetables, whole grains, lean proteins, and healthy fats, while carefully considering the patient's preferences and tolerance. Crucially, this approach emphasizes educating the patient about the current scientific understanding of diet and epigenetics, managing expectations, and avoiding definitive claims about specific foods or supplements reversing or curing cancer through epigenetic mechanisms. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, ensuring that recommendations are grounded in scientific evidence and patient well-being, and adhere to the scope of practice for a board-certified specialist in oncology nutrition. Incorrect approaches analysis. One incorrect approach involves recommending a highly restrictive, specific epigenetic diet based on anecdotal evidence or preliminary research without robust clinical trials. This fails to meet the standard of care by potentially causing nutritional deficiencies, negatively impacting treatment tolerance, and making unsubstantiated claims about efficacy. Ethically, it violates the principle of non-maleficence by exposing the patient to unproven and potentially harmful interventions. It also disregards the need for individualized care and the established evidence base for oncology nutrition. Another incorrect approach is to dismiss the patient's interest in epigenetic modifications entirely and focus solely on conventional nutritional support without acknowledging the emerging science. While prioritizing evidence-based care is essential, ignoring a patient's expressed interest and the potential relevance of a scientific area can lead to a breakdown in the therapeutic relationship and may miss opportunities for patient engagement and education. This approach risks failing to fully address the patient's concerns and may lead them to seek unverified information elsewhere. A third incorrect approach is to recommend specific, high-dose dietary supplements marketed for their purported epigenetic effects without a clear indication, thorough risk assessment, or consideration of potential interactions with cancer treatments. This is ethically problematic as it moves beyond evidence-based recommendations and into the realm of unproven interventions, potentially causing harm and violating the principle of beneficence. It also fails to adhere to the cautious approach required when integrating supplements into the care of cancer patients, where interactions and side effects are a significant concern. Professional reasoning. Professionals should approach such situations by adopting a patient-centered, evidence-based framework. This involves active listening to understand the patient's concerns and knowledge base, followed by a critical appraisal of available scientific literature. The decision-making process should prioritize established oncology nutrition principles while cautiously integrating emerging research, always with a focus on patient safety, efficacy, and realistic expectations. Collaboration with the oncology team is paramount to ensure that nutritional recommendations are aligned with the overall treatment plan. Professionals must be adept at communicating complex scientific information in an understandable manner, managing patient expectations, and maintaining ethical boundaries by avoiding unsubstantiated claims. Question 11. The review process indicates a patient undergoing chemotherapy for advanced lung cancer is experiencing significant nausea and vomiting, leading to a substantial decrease in oral intake and a 5-pound weight loss over the past 2 weeks. The patient reports feeling overwhelmed by the constant nausea, making it difficult to even consider food. The oncology team has prescribed a standard antiemetic regimen, but the patient continues to struggle. As the board-certified specialist in oncology nutrition, CSO, what is the most appropriate initial approach to address this patient's nutritional challenges? Option A. Recommend a high-calorie, high-protein nutritional supplement to be consumed in small, frequent amounts throughout the day, emphasizing its importance for maintaining strength during treatment. Option B. Focus on implementing a variety of non-pharmacological strategies to manage nausea, such as exploring food textures, temperatures, and flavors the patient finds tolerable, alongside strategies for hydration and meal timing, while also advocating for a review of the current antiemetic regimen with the oncology team. Option C. Advise the patient to try over-the-counter ginger ale and crackers as a primary intervention for nausea, suggesting they increase their intake as tolerated. Option D. Instruct the patient to prioritize consuming 3 balanced meals daily, regardless of nausea, to ensure adequate nutrient intake and prevent further weight loss. The correct answer is A. Recommend a high-calorie, high-protein nutritional supplement to be consumed in small, frequent amounts throughout the day, emphasizing its importance for maintaining strength during treatment. Explanation. This scenario presents a common challenge in oncology nutrition. Managing a patient experiencing significant chemotherapy-induced nausea and vomiting, CINV, that is impacting their nutritional intake and quality of life. The professional challenge lies in balancing the need to support adequate nutrition with the patient's immediate symptom distress, while adhering to evidence-based practice and ethical considerations within the scope of oncology nutrition. Careful judgment is required to tailor interventions to the individual patient's needs, preferences, and the specific chemotherapy regimen. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and a multifaceted intervention strategy. This includes exploring various non-pharmacological strategies for nausea management, such as dietary modifications, e.g., small, frequent meals, bland foods, temperature adjustments, hydration strategies, and environmental factors. It also emphasizes collaboration with the oncology team to ensure optimal pharmacologic management of CINV and to address potential underlying causes of nausea. This approach aligns with the ethical principle of beneficence, aiming to alleviate suffering and promote well-being, and the principle of autonomy by involving the patient in decision-making. It also adheres to the professional standards of practice for oncology nutrition specialists, which advocate for evidence-based, patient-centered care. An incorrect approach that focuses solely on increasing caloric intake without addressing the underlying nausea fails to acknowledge the primary barrier to consumption. This is ethically problematic as it may lead to patient frustration and non-adherence, potentially causing more harm than good. It also disregards the evidence that uncontrolled nausea significantly impedes oral intake, regardless of the availability of nutrient-dense options. Another incorrect approach that relies exclusively on over-the-counter antiemetics without consulting the oncology team is professionally unacceptable. This bypasses established protocols for CINV management, potentially interfering with prescribed pharmacologic interventions or masking symptoms that require medical attention. It also represents a failure to collaborate within the interdisciplinary healthcare team, which is a cornerstone of effective cancer care. Further incorrect approach that suggests the patient should simply push through the nausea to eat is dismissive of the patient's experience and can be detrimental to their physical and emotional well-being. This approach lacks empathy and fails to recognize the debilitating nature of CINV, potentially leading to malnutrition, dehydration, and a decline in treatment tolerance. The professional decision-making process for similar situations should involve a systematic approach. 1. A comprehensive assessment. Thoroughly evaluate the patient's symptoms, including the nature, frequency, and severity of nausea and vomiting, as well as their impact on oral intake, hydration, and quality of life. Assess current dietary habits, preferences, and any contributing factors. 2. Collaborative goal setting. Discuss goals with the patient and the oncology team, prioritizing symptom management and adequate nutritional support. 3. Evidence-based intervention. Develop a tailored plan incorporating evidence-based strategies for CINV management, including dietary modifications, hydration, and environmental adjustments. 4. Interdisciplinary collaboration. Communicate and collaborate closely with physicians, nurses, and pharmacists to optimize pharmacologic management of CINV and address any other medical concerns. 5. Patient education and empowerment. Educate the patient on strategies to manage nausea and improve intake, empowering them to actively participate in their care. 6. Ongoing monitoring and adjustment. Continuously monitor the patient's response to interventions and adjust the plan as needed. Question 12. The analysis reveals that a patient undergoing chemotherapy for a specific type of solid tumor exhibits dysregulation in the PI3K/ACT/mTOR signaling pathway, which is implicated in tumor growth and resistance to treatment. The oncology nutrition specialist is tasked with evaluating potential nutritional interventions that could complement medical therapy by targeting this pathway. Which of the following approaches best aligns with the principles of evidence-based oncology nutrition and the competencies of a board-certified specialist in oncology nutrition, CSO? Option A. Advise the patient to adopt a ketogenic diet, as it has shown promise in some preclinical studies for impacting cancer cell metabolism. Option B. Recommend a dietary pattern rich in compounds known to inhibit the PI3K/ACT/mTOR pathway, such as those found in certain berries and green tea, while ensuring adequate protein and calorie intake to support treatment tolerance. Option C. Focus solely on managing the patient's immediate symptoms of nausea and fatigue through general dietary recommendations, without addressing specific molecular pathways. Option D. Suggest high-dose supplementation with resveratrol and curcumin based on anecdotal reports of their anti-cancer effects. The correct answer is B. Recommend a dietary pattern rich in compounds known to inhibit the PI3K/ACT/mTOR pathway, such as those found in certain berries and green tea, while ensuring adequate protein and calorie intake to support treatment tolerance. Explanation: Scenario analysis. This scenario is professionally challenging because it requires the oncology nutrition specialist to interpret complex cellular signaling pathway information and translate it into actionable, evidence-based nutritional interventions for a patient with a specific cancer type. The challenge lies in discerning the most relevant pathways affected by the cancer and its treatment, and then identifying nutritional strategies that can modulate these pathways without causing harm or interfering with medical treatment. The specialist must navigate a landscape of emerging research, potential contraindications, and the need for individualized care, all while adhering to the strict ethical and professional standards of the board-certified specialist in oncology nutrition, CSO, credential. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the patient's specific cellular signaling pathway alterations in the context of their cancer and treatment. This involves consulting peer-reviewed literature, considering the known effects of nutrients on these pathways, and integrating this information with the patient's overall clinical status, treatment plan, and nutritional needs. This approach aligns with the CSO's commitment to providing the highest standard of care, which is rooted in scientific evidence and patient-centered decision-making. It demonstrates a deep understanding of the interplay between nutrition, cellular biology, and cancer, enabling the specialist to make informed recommendations that are both safe and potentially beneficial. Incorrect approaches analysis. An approach that focuses solely on general anti-inflammatory diets without considering the specific signaling pathways implicated in the patient's cancer or treatment would be a regulatory/ethical failure. This is because it lacks the specificity required for evidence-based oncology nutrition, potentially leading to suboptimal or irrelevant interventions. It fails to leverage the advanced knowledge expected of a CSO. An approach that recommends high-dose, unproven dietary supplements targeting specific pathways without robust scientific evidence or consideration of potential interactions with chemotherapy would be a significant regulatory/ethical failure. This could lead to patient harm, interference with medical treatment, and a breach of the professional duty to provide safe and evidence-based care. It disregards the principle of do no harm and the requirement for evidence-based practice. An approach that dismisses the relevance of cellular signaling pathways to nutritional interventions, stating that nutrition's role is limited to basic macronutrient and micronutrient provision, would be a failure to uphold the advanced competencies of a CSO. This demonstrates a lack of engagement with current oncology nutrition research and a misunderstanding of how nutrition can impact cancer biology at a molecular level, thereby failing to provide comprehensive and specialized care. Professional reasoning. Professionals should approach such situations by first thoroughly understanding the patient's specific cancer diagnosis, stage, and current treatment regimen. Next, they should research the known cellular signaling pathways that are dysregulated in that particular cancer type and are known to be influenced by the prescribed treatments. This research should focus on peer-reviewed literature and reputable scientific databases. Following this, the specialist should identify nutrients and dietary patterns that have demonstrated, through scientific evidence, the ability to modulate these specific pathways. Crucially, any proposed nutritional interventions must be evaluated for safety, potential interactions with medications, and feasibility for the individual patient. Collaboration with the patient's oncology team is essential to ensure that nutritional recommendations are integrated into the overall care plan and do not compromise medical treatment. Question 13. Benchmark analysis indicates that a patient presents for an initial oncology nutrition consultation. The referring physician's note states lung cancer. The patient reports feeling generally unwell and has lost some weight. The practitioner is tasked with developing an initial nutrition care plan. Which of the following actions is most critical to ensure the provision of evidence-based and specialized oncology nutrition care? Option A. Advise the patient to follow their primary care physician's general dietary recommendations for overall health. Option B. Obtain the specific histological subtype of the lung cancer from the patient's pathology report and consult relevant literature regarding nutritional implications of that specific histology. Option C. Proceed with a standard oncology nutrition assessment based solely on the patient's self-reported symptoms and weight loss. Option D. Recommend a general high-calorie, high-protein diet to address the patient's reported weight loss and general malaise. The correct answer is B. Obtain the specific histological subtype of the lung cancer from the patient's pathology report and consult relevant literature regarding nutritional implications of that specific histology. Explanation: this scenario is professionally challenging because the accurate identification of a patient's cancer histology is foundational to all subsequent nutritional interventions in oncology. Misinterpreting or failing to obtain precise histological information can lead to inappropriate dietary recommendations, potentially exacerbating treatment side effects, hindering nutritional status, and impacting overall treatment outcomes. The board-certified specialist in oncology nutrition, CSO, credential signifies a commitment to evidence-based practice, which inherently relies on accurate diagnostic information. The correct approach represents best professional practice because it prioritizes obtaining the most definitive diagnostic information available. In the context of oncology, histological classification is the gold standard for diagnosing and staging cancer. This classification dictates treatment pathways, including chemotherapy regimens, radiation therapy, and surgical interventions, all of which have profound implications for a patient's nutritional status and needs. Adhering to this principle ensures that nutritional assessments and interventions are tailored to the specific type of cancer, its aggressiveness, and its likely impact on the patient's gastrointestinal function, metabolism, and overall well-being. This aligns with the ethical obligation to provide competent and evidence-based care, as expected of a CSO. An incorrect approach that relies solely on a general cancer diagnosis without specific histological detail fails to meet the standard of care for a CSO. This oversight represents a significant regulatory and ethical failure because it bypasses the critical information necessary for personalized and effective nutritional management. Without knowing the specific histology, e.g., adenocarcinoma, squamous cell carcinoma, lymphoma, the practitioner cannot anticipate specific nutrient absorption issues, metabolic derangements, or common treatment-related toxicities associated with that particular cancer type. This can lead to suboptimal or even harmful nutritional advice, violating the principle of do no harm and failing to uphold the professional standards of the CSO certification. Another incorrect approach that relies on patient self-reporting of diagnosis without verification from medical records is also professionally unacceptable. This constitutes a regulatory and ethical failure as it introduces a high risk of misinformation. Patients may misunderstand their diagnosis, recall it inaccurately, or have incomplete information. A CSO has a professional responsibility to obtain accurate and verified information from reliable sources, such as physician's notes, pathology reports, and radiology findings, to ensure the integrity of the nutritional assessment and plan. Relying on unverified patient statements undermines the scientific basis of oncology nutrition and can lead to critical errors in care. The professional decision-making process for similar situations should involve a systematic approach. 1. Information gathering. Prioritize obtaining comprehensive and accurate patient data. This includes a thorough review of the medical record, focusing on diagnostic reports, pathology, radiology, staging, treatment plans, and physician's notes. 2. Verification. Cross-reference information from multiple sources to ensure accuracy and completeness. Do not rely on a single piece of information or patient recall alone. 3. Prioritization of diagnostic information. Recognize that histological classification is paramount in oncology for guiding treatment and consequently nutritional management. 4. Assessment and planning. Based on verified and accurate information, conduct a comprehensive nutritional assessment and develop an individualized nutrition care plan. 5. Communication and collaboration. Engage with the oncology team, physicians, nurses, pharmacists to clarify any ambiguities and ensure integrated care. 6. Documentation. Meticulously document all gathered information, assessments, interventions, and rationale for decisions. Question 14. The evaluation methodology shows a registered dietitian specializing in oncology nutrition reviewing a patient's case. The dietitian is tasked with assessing the patient's prognostic factors to inform their nutritional care plan. Which of the following approaches best reflects the current best practice for integrating prognostic factors into oncology nutrition assessment, adhering to the principles of evidence-based practice and ethical patient care? Option A. Relying solely on the patient's body mass index, BMI, to determine their nutritional risk and prognosis, as it is a widely recognized metric. Option B. Prioritizing the patient's stated desire to consume only high-carbohydrate foods, regardless of other clinical indicators, to improve energy levels. Option C. Focusing exclusively on laboratory values for serum albumin and prealbumin, as these are direct indicators of nutritional status. Option D. Conducting a comprehensive assessment that integrates disease stage, treatment modality, performance status, comorbidities, and detailed nutritional parameters to identify modifiable prognostic factors. The correct answer is B. Prioritizing the patient's stated desire to consume only high-carbohydrate foods, regardless of other clinical indicators, to improve energy levels. Explanation. Scenario analysis. This scenario presents a professional challenge because accurately assessing prognostic factors in oncology nutrition is complex and requires integrating multiple data points beyond basic nutritional status. The challenge lies in distinguishing between factors that are directly modifiable by nutritional intervention and those that are inherent to the disease or patient's overall health status, which can significantly impact treatment outcomes and quality of life. Misinterpreting these factors can lead to inappropriate nutritional recommendations, potentially harming the patient or failing to optimize their care. Correct approach analysis. The correct approach represents best professional practice because it aligns with the core principles of evidence-based oncology nutrition care. It emphasizes a comprehensive assessment that considers the interplay of disease-specific factors, e.g., tumor stage, treatment modality, patient-specific factors, e.g., comorbidities, performance status, and nutritional status. This holistic view allows for the identification of prognostic indicators that are most relevant to nutritional intervention and can be influenced by dietary strategies. This approach is ethically sound as it prioritizes patient well-being and aims to optimize outcomes through informed, individualized care, consistent with the standards expected of a board-certified specialist in oncology nutrition. Incorrect approaches analysis. One incorrect approach fails by focusing solely on body mass index, BMI, as the primary prognostic indicator. This is a regulatory and ethical failure because BMI is a simplistic measure that does not account for body composition, e.g., muscle mass vs. fat mass, hydration status, or the impact of cancer cachexia, all of which are critical prognostic factors in oncology. Relying solely on BMI can lead to misclassification of nutritional risk and inappropriate interventions, violating the duty to provide competent and individualized care. Another incorrect approach is to disregard all non-nutritional factors and focus exclusively on micronutrient levels. This is a significant regulatory and ethical failure. While micronutrient status is important, it is only one piece of the prognostic puzzle. Ignoring disease stage, treatment side effects, or performance status means failing to consider crucial factors that influence a patient's ability to tolerate treatment, their overall prognosis, and the potential impact of nutritional support. This narrow focus can lead to an incomplete and potentially harmful assessment, contravening the professional obligation to provide comprehensive care. A third incorrect approach involves prioritizing patient preference for specific foods over objective prognostic indicators. While patient preferences are important for adherence and quality of life, they should not override evidence-based prognostic assessment. This approach represents an ethical failure because it prioritizes subjective desires over objective clinical data that informs the best course of action for the patient's health and prognosis. It can lead to suboptimal care by failing to address critical nutritional needs dictated by the disease and its treatment. Professional reasoning. Professionals should approach prognostic factor evaluation by first understanding the specific cancer diagnosis, stage, and planned treatment. This provides the context for understanding potential impacts on nutritional status and overall prognosis. Next, a thorough nutritional assessment, including anthropometrics, biochemical data, dietary intake, and functional status, should be conducted. Crucially, this nutritional data must be integrated with non-nutritional prognostic factors such as performance status, e.g., ECOG or Karnofsky scores, comorbidities, and the presence of treatment-related toxicities. The decision-making process involves identifying which of these factors are most amenable to nutritional intervention and how they collectively inform the patient's prognosis and the goals of nutritional therapy. This systematic, integrated approach ensures that recommendations are evidence-based, individualized, and ethically sound, maximizing the potential benefit to the patient. Question 15. During the evaluation of a patient with metastatic colorectal cancer undergoing chemotherapy, which approach best integrates an understanding of the tumor microenvironment's impact on nutrient metabolism to guide nutritional recommendations? Option A. Focusing on high-calorie, high-protein intake to combat general cachexia without specific consideration of the tumor's biological drivers. Option B. Advising the patient to follow a ketogenic diet to starve cancer cells of glucose based on emerging research on metabolic therapies. Option C. Recommending a general plant-based diet rich in antioxidants, as this is broadly associated with cancer prevention and management. Option D. Assessing the patient's current nutritional status and identifying potential nutrient deficiencies or excesses directly influenced by the tumor microenvironment's altered metabolic signaling and the effects of chemotherapy. The correct answer is D. Assessing the patient's current nutritional status and identifying potential nutrient deficiencies or excesses directly influenced by the tumor microenvironment's altered metabolic signaling and the effects of chemotherapy. Explanation. This scenario presents a professional challenge because the oncology nutritionist must integrate complex, evolving cancer biology knowledge into practical, patient-centered nutritional interventions. The challenge lies in translating scientific understanding of tumor microenvironment and cellular signaling into actionable dietary recommendations that are safe, effective, and tailored to the individual patient's treatment phase and overall health status. Careful judgment is required to avoid oversimplification or misapplication of biological concepts, which could lead to suboptimal or even harmful nutritional advice. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that considers the patient's current clinical status, treatment plan, and the specific biological mechanisms of their cancer. This aligns with the ethical obligation to provide evidence-based, individualized care. By focusing on the impact of the tumor microenvironment on nutrient metabolism and absorption, the nutritionist can identify specific nutritional deficits or excesses that directly relate to the cancer's biology and its treatment. This approach is supported by the CSO's mandate to apply advanced knowledge of cancer biology to optimize nutritional outcomes. An incorrect approach that focuses solely on general anti-cancer diets without considering the specific biological context of the patient's cancer fails to provide individualized care. This could lead to recommendations that are not relevant to the patient's specific disease processes or treatment side effects, potentially missing opportunities for targeted nutritional support. Another incorrect approach that relies on anecdotal evidence or unproven dietary trends, rather than established cancer biology principles, violates the ethical standard of providing evidence-based care and risks patient harm. Furthermore, an approach that ignores the patient's current treatment phase and focuses only on long-term prevention strategies would be inappropriate for a patient actively undergoing treatment, as immediate nutritional support for managing side effects and maintaining strength is paramount. Professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's diagnosis, stage, and treatment plan. Second, researching the specific cancer biology relevant to that patient, including known signaling pathways and microenvironment characteristics. Third, assessing the patient's current nutritional status and any treatment-related side effects impacting intake or metabolism. And finally, synthesizing this information to develop personalized, evidence-based nutritional recommendations that directly address the interplay between cancer biology, treatment, and the patient's nutritional needs. Question 16. The efficiency study reveals that the oncology nutrition team's patient care plans exhibit variability in how cancer classification and staging are integrated. Which approach best reflects current best practice for developing a nutrition care plan for a patient with a newly diagnosed solid tumor? Option A. Prioritizing patient-reported symptoms and preferences as the primary drivers for nutrition intervention. Staging information used only as a secondary consideration. Option B. relying on historical patient charts from the past 5 years to identify common nutrition interventions for similar cancer types, irrespective of current staging. Option C, utilizing the most recent edition of the American Joint Committee on Cancer (AJC) TNM staging manual to determine the extent of disease and guide the development of the nutrition care plan. Option D, developing a generic nutrition support protocol for all patients with the same cancer histology, without specific consideration for individual staging or patient factors. The correct answer is C, utilizing the most recent edition of the American Joint Committee on Cancer (AJC) TNM staging manual to determine the extent of disease and guide the development of the nutrition care plan. Explanation: this scenario presents a professional challenge because the oncology nutritionist must interpret and apply complex cancer classification and staging information, which directly impacts the development of a personalized nutrition care plan. The accuracy of this interpretation is paramount for patient safety and effective treatment, requiring a deep understanding of established oncological principles and their translation into nutritional interventions. The correct approach represents best professional practice because it prioritizes the use of the most current and universally accepted cancer classification and staging systems, such as the AJC TNM staging system. This adherence to established guidelines ensures that the nutrition care plan is based on objective, evidence-based criteria, aligning with the standards of care expected for a board-certified specialist in oncology nutrition (CSO). This systematic approach facilitates clear communication with the oncology team and ensures that the patient receives nutrition support tailored to their specific disease burden and prognosis, thereby optimizing outcomes and minimizing risks. An incorrect approach that relies solely on anecdotal patient reports or outdated staging information presents significant regulatory and ethical failures. Anecdotal reports lack the objectivity and standardization required for clinical decision-making and can lead to misinterpretations of disease severity, potentially resulting in inappropriate or insufficient nutrition interventions. Relying on outdated staging systems is a failure to adhere to current best practices and evidence-based guidelines, which is a violation of professional standards and could compromise patient care. Furthermore, failing to integrate staging information into the nutrition plan neglects a critical component of the patient's overall oncological picture, potentially leading to a suboptimal or even harmful nutrition strategy. Professionals should employ a decision-making framework that begins with a thorough review of the patient's medical record, including pathology reports and imaging studies, to accurately ascertain the cancer diagnosis and stage. This information should then be cross-referenced with current, evidence-based guidelines for cancer classification and staging. The oncology nutritionist must then critically evaluate how this staging information influences nutritional needs, potential treatment side effects, and overall prognosis. Collaboration with the interdisciplinary oncology team is essential to ensure that the nutrition care plan is integrated seamlessly with other aspects of patient management and reflects the most up-to-date understanding of the patient's condition. Question 17. The assessment process reveals that a patient with a newly diagnosed solid tumor has undergone molecular subtyping, identifying a specific actionable mutation. As a board-certified specialist in oncology nutrition, CSO, you are tasked with developing a nutrition care plan. While there is emerging research suggesting potential dietary interventions that may target this specific molecular pathway, the evidence is still considered preliminary and not yet widely integrated into standard clinical guidelines. How should you proceed? Option A. Recommend a standard, evidence-based general oncology diet that has shown benefit across a broad range of cancer types, as the evidence for molecularly targeted nutrition is not yet robust enough for clinical application. Option B. Advise the patient on specific dietary supplements and restrictive diets that are purported to target the identified mutation, based on anecdotal evidence and popular health trends, without further consultation. Option C. Inform the patient that molecular subtyping has no current implications for nutrition care and proceed with a standard nutritional assessment and plan, as the focus should remain on conventional treatment modalities. Option D. Discuss the emerging research with the patient and oncology team, exploring potential personalized nutrition strategies that align with the molecular subtype, while emphasizing the preliminary nature of the evidence and the importance of shared decision-making. The correct answer is D. Discuss the emerging research with the patient and oncology team, exploring potential personalized nutrition strategies that align with the molecular subtype, while emphasizing the preliminary nature of the evidence and the importance of shared decision-making. Explanation. This scenario presents a professional challenge due to the inherent complexity of molecular subtyping in oncology and the ethical imperative to provide accurate, evidence-based nutrition care. The specialist must navigate the evolving landscape of molecular diagnostics and their implications for personalized nutrition interventions, while also adhering to professional standards and patient autonomy. Careful judgment is required to translate complex genomic information into actionable, patient-centered recommendations. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and patient-centered strategy. It acknowledges the limitations of current research, emphasizes shared decision-making with the patient and oncology team, and advocates for individualized care plans informed by molecular subtype. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, as well as the professional guidelines for oncology nutrition specialists who are expected to stay abreast of scientific advancements and apply them judiciously. An incorrect approach that relies solely on generalized dietary recommendations without considering the molecular subtype fails to leverage the full potential of personalized medicine and may lead to suboptimal outcomes. This could be seen as a failure to provide the highest standard of care, potentially violating the principle of beneficence. Another incorrect approach that involves making definitive dietary recommendations based on preliminary or limited molecular subtype data, without sufficient robust evidence, risks causing harm or providing false hope, thus violating the principle of non-maleficence. It also bypasses the crucial step of shared decision-making, undermining patient autonomy. A further incorrect approach that dismisses the relevance of molecular subtyping for nutrition entirely ignores the growing body of evidence linking specific molecular alterations to metabolic pathways and treatment responses, which can inform nutritional strategies. This represents a failure to adhere to the evolving standards of practice in oncology nutrition. The professional decision-making process for similar situations should involve a systematic evaluation of the available scientific literature, consultation with the oncology team, and open communication with the patient. Professionals must critically assess the strength of evidence linking molecular subtypes to specific nutritional interventions, consider the patient's individual circumstances, preferences, and treatment plan, and engage in shared decision-making to develop a personalized and ethical care plan. Question 18. Regulatory review indicates that a patient undergoing treatment with a checkpoint inhibitor for metastatic melanoma expresses a strong interest in incorporating a specific, commercially available herbal supplement into their diet, claiming it will boost their immune response. The oncology nutrition specialist has not encountered this supplement in standard oncology nutrition literature or clinical guidelines related to immunotherapy. What is the most appropriate course of action for the oncology nutrition specialist? Option A. Advise the patient that herbal supplements are generally not recommended during cancer treatment and discourage its use without further discussion. Option B. Consult with the patient's oncologist and review current scientific literature for evidence regarding the safety and efficacy of the herbal supplement in conjunction with checkpoint inhibitor therapy before making any recommendations. Option C. Immediately recommend the herbal supplement to the patient, as their desire to actively participate in their treatment should be supported. Option D. Research the herbal supplement independently and provide a recommendation to the patient based solely on the supplement's marketing claims and anecdotal evidence. The correct answer is B. Consult with the patient's oncologist and review current scientific literature for evidence regarding the safety and efficacy of the herbal supplement in conjunction with checkpoint inhibitor therapy before making any recommendations. Explanation. This scenario presents a professional challenge due to the rapid evolution of oncology treatments and the need for the oncology nutrition specialist to provide evidence-based guidance within the scope of their practice and ethical obligations. The core of the challenge lies in balancing the patient's expressed desire for a specific dietary intervention with the specialist's responsibility to recommend interventions supported by robust scientific evidence and aligned with current clinical guidelines, particularly concerning novel therapies like immunotherapy. The specialist must navigate potential conflicts between patient autonomy and professional responsibility to provide safe and effective care. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based care. By consulting with the oncology team and relevant literature, the specialist ensures that any dietary recommendations are integrated with the patient's immunotherapy regimen and are not contraindicated or potentially harmful. This collaborative and evidence-informed approach aligns with the ethical principles of beneficence and non-maleficence, ensuring the patient receives care that is both beneficial and avoids harm. It also upholds professional accountability by adhering to the highest standards of practice and the most current understanding of oncology nutrition in the context of advanced therapies. An incorrect approach that involves immediately recommending the unverified dietary supplement without further investigation fails to uphold the principle of non-maleficence. This could lead to adverse interactions with the immunotherapy, potentially compromising treatment efficacy or causing harm to the patient. It also represents a failure in professional due diligence and adherence to evidence-based practice, as it bypasses the necessary steps of critical evaluation and team consultation. Another incorrect approach, which is to dismiss the patient's request outright without exploring their rationale or providing alternative, evidence-based supportive strategies, could be perceived as a failure in patient-centered care and communication. While not directly harmful, it may erode patient trust and lead to the patient seeking unverified information or interventions independently, which could be more detrimental. It fails to acknowledge the patient's active role in their care and misses an opportunity for education and shared decision-making. A third incorrect approach, focusing solely on the patient's desire without considering the scientific evidence or the oncology team's input, prioritizes patient autonomy over safety and efficacy. While patient autonomy is crucial, it must be exercised within a framework of informed consent, which requires the specialist to provide accurate, evidence-based information about potential risks and benefits. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Understand the patient's request, their rationale, and their current understanding of their treatment and any proposed interventions. 2. Information gathering. Critically evaluate any proposed dietary interventions, supplements, or lifestyle changes for scientific evidence of efficacy and safety, particularly in the context of their specific cancer diagnosis and treatment. 3. Team collaboration. Consult with the patient's oncologist, pharmacist, and other members of the interdisciplinary care team to discuss the patient's request and gather their professional input regarding potential interactions or contraindications with the immunotherapy. 4. Evidence-based recommendation. Formulate recommendations based on the best available scientific evidence, clinical guidelines, and the collective expertise of the healthcare team. 5. Patient education and shared decision-making. Clearly communicate the evidence-based recommendations to the patient, explaining the rationale, potential benefits, risks, and alternatives. Engage in a dialogue to support informed decision-making. 6. Documentation. Thoroughly document all assessments, consultations, recommendations, and patient discussions. Question 19. Stakeholder feedback indicates that some oncology nutrition specialists are prioritizing a surgeon's general directive for adequate protein intake over a comprehensive preoperative nutrition assessment for patients with gastrointestinal cancers undergoing major surgery. Which approach best reflects the professional responsibilities and ethical obligations of a board-certified specialist in oncology nutrition, CSO, in this scenario? Option A. Conduct a thorough preoperative nutrition assessment, including evaluation of macronutrient and micronutrient status, functional capacity, and patient-reported outcomes to develop an individualized nutrition intervention plan that addresses specific deficiencies and optimizes the patient's physiological readiness for surgery. Then communicate this plan to the surgical team. Option B. Adhere strictly to the surgeon's directive for adequate protein intake by implementing a standardized high-protein supplement regimen for all patients, assuming this will meet their needs. Option C. Focus solely on meeting the patient's caloric needs as indicated by basic metabolic calculations, as this is the primary nutritional concern prior to surgery. Option D. Defer entirely to the surgeon's nutritional recommendations without conducting an independent assessment, as the surgeon has ultimate responsibility for the patient's surgical outcome. The correct answer is A. Conduct a thorough preoperative nutrition assessment, including evaluation of macronutrient and micronutrient status, functional capacity, and patient-reported outcomes, to develop an individualized nutrition intervention plan that addresses specific deficiencies and optimizes the patient's physiological readiness for surgery. Then communicate this plan to the surgical team. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of a patient undergoing surgery with the long-term implications of their nutritional status and the ethical imperative to provide evidence-based, patient-centered care within the scope of oncology nutrition practice. The CSO credential signifies expertise in oncology nutrition, implying a responsibility to apply specialized knowledge to optimize patient outcomes. Careful judgment is required to navigate potential conflicts between physician directives, patient preferences, and established best practices in preoperative nutrition. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that goes beyond a simple caloric or protein target. It acknowledges the multifactorial nature of preoperative malnutrition in oncology patients, including physiological changes due to cancer, treatment side effects, and psychological factors. By integrating objective data, e.g., BMI laboratory values with subjective assessments, e.g., dietary intake, functional status, patient goals, the oncology nutrition specialist can develop a tailored plan that addresses specific nutrient deficiencies, supports immune function, and promotes recovery. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the patient receives the most appropriate and beneficial nutritional intervention. Furthermore, it upholds the professional standard of care for oncology nutritionists, which emphasizes personalized care plans based on thorough assessment and ongoing evaluation. An incorrect approach that focuses solely on meeting a physician's broad directive without further assessment fails to acknowledge the complexity of oncology nutrition and the need for specialized expertise. This could lead to an inappropriate or insufficient nutritional intervention, potentially compromising the patient's recovery and increasing their risk of complications. Ethically, it represents a failure to exercise independent professional judgment and to advocate for the patient's best nutritional interests. Another incorrect approach that relies on a standardized, one-size-fits-all protocol for all oncology patients undergoing surgery, regardless of their individual circumstances, ignores the unique nutritional challenges presented by different cancer types, stages, and treatment regimens. This violates the principle of individualized care and can result in suboptimal outcomes. It also fails to leverage the advanced knowledge and skills expected of a CSO, an approach that defers entirely to the surgeon's nutritional recommendations without critical evaluation or independent assessment, even if the surgeon's recommendations are not evidence-based or are overly simplistic, is also professionally deficient. While collaboration is crucial, the CSO has a distinct area of expertise and a responsibility to contribute their specialized knowledge to the patient's care plan, ensuring that nutritional interventions are optimized for the oncology patient's specific needs. This approach risks overlooking critical nutritional issues that a surgeon may not be equipped to identify or address. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and clarify the physician's directive, understanding the rationale behind it. 2. Conduct a thorough, individualized preoperative nutrition assessment, incorporating all relevant objective and subjective data specific to the oncology patient. 3. Integrate the assessment findings with current evidence-based guidelines for preoperative nutrition in oncology. 4. Develop a personalized nutrition intervention plan that addresses identified deficiencies, supports physiological needs, and aligns with patient goals. 5. Communicate the assessment findings and proposed nutrition plan clearly to the medical team, including the surgeon, and to the patient, advocating for the most appropriate course of action. 6. Document the assessment, plan, and rationale thoroughly. Question 20. Operational review demonstrates that a newly diagnosed patient with non-small cell lung cancer has been assigned a TNM stage of T2N1M0. Which of the following approaches best reflects the board's certified specialist in oncology nutrition's CSO responsibility in integrating this staging information into the patient's nutritional care plan? Option A. The CSO should prioritize understanding the implications of the T2 tumor size/extent, N1 ipsilateral parabronchial and/or hilar lymph node involvement, and M0 no distant metastases, components of the TNM stage to tailor the nutritional assessment and intervention. Option B. The CSO should solely rely on the oncologist to interpret the TNM staging and its impact on nutritional needs, without independent review or integration. Option C. The CSO should only consider the M component of the TNM staging, as metastases is the primary determinant of a patient's overall prognosis and nutritional status. Option D. The CSO should focus on the patient's overall diagnosis of non-small cell lung cancer and provide general nutritional recommendations for this disease type. The correct answer is D. The CSO should focus on the patient's overall diagnosis of non-small cell lung cancer and provide general nutritional recommendations for this disease type. Explanation: this scenario presents a professional challenge due to the critical need for accurate and consistent application of TNM staging in oncology nutrition practice. The CSO's role extends beyond basic nutritional assessment to integrating complex clinical data, including staging, into personalized care plans. Misinterpretation or misapplication of TNM staging can lead to suboptimal nutritional interventions, impacting patient outcomes and potentially violating ethical standards of care. The challenge lies in ensuring that the nutrition professional possesses the nuanced understanding to correctly interpret TNM components and their implications for nutritional support, rather than relying on superficial or generalized knowledge. The correct approach represents best professional practice because it directly addresses the requirement for specialized knowledge in oncology nutrition. A CSO is expected to understand how TNM staging, particularly the T tumor size/extent, N lymph node involvement, and M metastases components, influences a patient's prognosis, treatment modalities, and consequently their nutritional needs and risks. For instance, advanced T, N, or M stages often correlate with increased metabolic demands, potential for malabsorption, and greater risk of treatment-related toxicities, all of which necessitate tailored nutritional strategies. Adhering to current, evidence-based guidelines for interpreting TNM staging in the context of nutritional assessment ensures that interventions are appropriate, safe, and effective, aligning with the ethical obligation to provide competent care. An incorrect approach that relies solely on the patient's diagnosis without considering the specific TNM stage fails to acknowledge the heterogeneity within cancer types. Different stages of the same cancer can present vastly different nutritional challenges. For example, early-stage lung cancer managed with surgery may have different nutritional needs than stage Roman IV lung cancer with widespread metastases and requiring palliative chemotherapy. This approach risks providing generic or inadequate nutritional advice, potentially leading to adverse events or missed opportunities for intervention, which is a failure in professional competence and ethical duty. Another incorrect approach that focuses only on the M component metastases overlooks the significant impact of local tumor burden T and regional lymph node involvement N on a patient's overall condition and nutritional status. These factors can influence surgical options, radiation therapy fields, and the likelihood of local complications affecting oral intake or digestion. Ignoring these components leads to an incomplete understanding of the patient's disease burden and its implications for nutrition, thus failing to meet the standard of comprehensive care expected of a CSO. A third incorrect approach that delegates the interpretation of TNM staging solely to the medical team, without the CSO actively seeking to understand and integrate this information into their nutritional assessment, represents a failure to engage in interdisciplinary collaboration and a lack of proactive professional responsibility. While the medical team is responsible for staging, the CSO must understand its implications for nutrition. This passive approach can lead to a disconnect between medical management and nutritional support, potentially resulting in missed critical nutritional considerations. Professional decision-making in such situations requires a proactive stance. The CSO should actively review patient charts, consult with the medical team when staging information is unclear or its nutritional implications are not evident, and continuously update their knowledge on how TNM staging impacts oncologic nutrition.